Your Excellency, the President of the Republic of Kenya and the Commander-in-Chief of the Kenya Defense Forces, my colleague CS Education and PS Education, PS Irrigation, the Governor of Kajiado and members of Parliament from Kajiado, the entire leadership, the founders and the donors of Oma University, the students, the lecturers. Your Excellency, if you allow me, I'll ask, I am a former majority leader, and there are very good leaders here. There is Honorable Kainan, who is the chairman of Northeastern Parliamentary Group. There is Honorable Senior Farah Maalim. There is Honorable Abbas of Senator Wajir. There is Honorable Major Bashir of Mandera North. There is the Speaker of Kajiado County. There is the MP for Kajiado West. There is the MP for Kajiado East. Is there any other member I've forgotten? There is a former MP, Honorable Kolosh. There is the MP for the great town of Elwak, Honorable Kore. And there is our deputy governor, the tallest man in our counties. Your Excellency, you are not a visitor here, neither to Uma University or to this community. You went to Uma University as a baby in a small college in 2010 in a very dingy corner in Thika town. That day I was with you and I was saying, why did I brought the minister here? But you went because you believe in the equity and you believe in the people of Kenya and you believe in the education. Then 2014, you came here, Oma University, and because you believe in progress and transformation, today you are coming here when Oma University is in a different league. It's among one of our best universities. So, Your Excellency, we don't take that for granted as a community. Our Vice Chancellor, and we have shown you today, Your Excellency, demonstrated that a pastoralist girl, a Muslim lady, can become a Vice Chancellor. There are many, but at least Oma University, I really want to thank the Chancellor and the board for seeing the talent. But Your Excellency, I want you to forgive me. This is an education function, but because I also post their interns, nursing. So I have also a stake here. And because they want to build a medical school, I don't know whether I will still be the Minister for Health. That time they'll also require me. So you'll allow me, Your Excellency, because the other day, a lot of misinformation was said about your health transformation agenda. And this is because never before in our country, your transformation health agenda is as clear as the day and the night. And we really want to ask those who want to critique us on our reforms, whether it's in the health sector, in education, in agriculture, to critique us with the facts and figures, not figures thrown like a pedestrian. And why am I saying so? Today, as we sit here, under your leadership, 26.5 million Kenyans have registered to the Social Health Authority with Kajiado County, and the governor is here, over 470,000. When in the previous administration, under the former NHIF, it was only 7 million. So from 7 million to 26.5 million, you'll tell us which one is transformative in the health sector. Today, in 9 months, since Health SHA was formed, Your Excellency, 17.5 million Kenyans visited health facilities. over 10,000 health facilities. Of these 17.5, 12.5 million Kenyans accessed free primary care paid by the government of Kenya. They went to dispensaries, they went to health centers, they went to sub-county hospitals as outpatients, they went home without paying a coin. I don't know whether that is transformative or that is reducing the gains somebody else has made. Your Excellency, the other 5 million went through Social Health Insurance Fund by accessing specialized care in our level 4, level 5, and level 6. In 9 months, under Shah, we mobilized 70 billion Kenya shillings. 3 times or 4 times what NHIF could mobilize in many years. But let me come to the animal in the room. The benefits of Linda Mama. Yes, I agree with you. You know, I was looking for an opportunity. I looked at your diary. I saw you are coming to Umma, and I realized this is the best opportunity, so I had to drive 3 hours. 1 hour in expressway. Me and the governor were neighbors. We are residents of Kiambu. The benefits of Linda Mama, as was said, has not been scrapped. Nobody has scrapped Linda Mama. But what have we done? We have enhanced the cover of Linda, of the mother, and added the family, the children. You are only taking care of the mama by giving her 2,000 or 5,000, and they could only access facility at dispensary and health center. And if you think Linda Mama was a big thing for you, how come it has not reduced the maternal mortality rate in our country? This is an agenda the president and myself want to start now. We have 20 counties that we feel the maternal mortality rates are high. So if your Linda Mama was good, then how come the maternal mortality rates, and these are not figures, even the World Health Organization will agree with me, but we enhanced. What have we enhanced? Because we don't lie. We have enhanced, we have included antenatal, postnatal, delivery, and we have given the whole family that package. Today, Your Excellency, in 9 months under Shah, 627,155 mothers have delivered in the Republic of Kenya. Our delivery is about 1.1 million. But under Shah, you know, the mothers who deliver, the wife of the governor uses a very expensive insurance. She doesn't fall under Shah. She goes deliver, so I don't count. I'm only counting those who benefited from Social Health Authority, 627,000. Out of these 27,000, who we covered the mother, we covered the whole journey, prenatal, postnatal. We made her she deliver safely. If there was complication, we took her through cesarean. We followed the child. We followed the family. 627. And out of these, 41,000 of these were teenage mothers paid by Social Health Authority. In fact, all teenage mothers in our country, if they deliver, they will deliver free. What does that mean? Under President William Ruto, we have introduced a more integrated system with financial protection to all families. Let me now give them, because even they have not even read NHIF. What was NHIF giving? In NHIF, when a child was born, they were only covered the mother. This really exposed the whole family, hardship for the children that required immediate medical care after birth. So mama delivers, she's left alone. As we follow the family, we follow the mother, we follow the child. We have a very integrated, comprehensive health insurance system. The newborn under SHA is covered under the mother's cover. The cover of the mother protects the child. That was not there during NHIF. Linda Mama reimbursement rates under the defunct NHIF was as low as 2,500. Sometimes it's 5,500 per delivery in dispensary and health centers. The quality, the care, nobody bothered. There was a persistent high maternal mortality rate in our country. And by the way, it continued to occur despite the high number of mothers giving birth in hospitals. Your Excellency, you have given vulnerable mother or the vulnerable woman who goes to antenatal clinic, who deliver, and who has postnatal care. Don't listen to naysayers. But because I'm giving information, they left us with 30 billion fictitious NHIF debt. Out of that debt, Linda Mama debt under NHIF inpatient was 4.8 billion. Outpatient was 306 million. In total, my good friend, my former leader, you have left us with 5.6 billion Linda Mama. You should thank us. We did not look for the money. We did not went to public liars and said you left us. You left us with many debt. But today, because you started it, Linda Mama left a debt with us, Your Excellency. But Your Excellency, I think those are just to make sure you gave me an opportunity to correct it. But I want to assure you, this afternoon I'll meet. Every month, this month we paid 8.1 billion shillings to both public, private, and faith-based. Governor Lenku is my witness, Your Excellency, here. Today, the highest own source of revenue for our counties is the health sector. True or false? Because today, more Kenyans go to public health facilities than to the dingy, small fraud things. My colleague, the Minister for Education, will come and tell the reforms. Agriculture, at your own backyard, we know what we have done. Your coffee prices, your tea prices were at the bottom. Even they should thank us. So just for that, to make the record straight, Your Excellency, and I will later tweet it, those who are not here, and I'll put it on my Facebook. But you have given me an opportunity. Your Excellency, it's called the law of relevance. On that one, I am wrong. This was an education function. But because they train nurses, This morning I look at it, where do I come in this university? The Vice Chancellor, her nurses are interns, and I'm the one who, well, through you, we pay government. So I am a stakeholder here, and they're looking for medicine, apart from the community and all that. So, Your Excellency, that law of relevance, I think you'll forgive me, I think because of nursing, but I wanted to make sure and tell the people, those who are pedestrian. And finally, Your Excellency, first they said we are mobilizing this region, They said Ruto must go. They say war this to one term. Now yesterday they started a new story, that all these team were together, half of them are projects of Ruto. Can you imagine? Themselves are saying You are a project. You are a project. You are a project. No agenda. Ruto must go. It's not an agenda for Kenya. This one is a project, it's not an agenda. Your Excellency, on behalf of these great people, we, this community, and who is who in this community? The religious leaders are sitting here. The political leaders are sitting here. Count on us. Am I right? Should the president count on us? Yeah. In 2015, he was told not to come here. But he said, these are my people. That's why their candidates are dropping. From Magarini to Banisa to Malava to where. And if you are a serious politician and you see at the rate in which your candidates are dropping, you must ask yourself a question. What is going on? Thank you, Your Excellency.